A lot of changes happen during the second half of life. Join Kash Mahmood, owner of Vargo Hospice and Home Health, and his guest as they explore topics to help you navigate the second half of your life. And now, here's Kash.
Hello, everyone, and welcome to Second Half of Life with me, Kash Mahmood. Our very special guest today is Jack Angel with Senior Care Authority. Today, we will be talking about how to pay for senior care. Jack, how are you doing today?
I'm well, Kash. Thank you so much. And I really appreciate what Vargo is doing to address this very real concern with many of us as we start to work through the second half of life.
I agree. Well, I was thinking we dive right in. Before we go into the questions, would you mind sharing a little bit about yourself and how you got into this?
Thank you, Kash. I appreciate the opportunity. And as noted, my name is Jack Angel. I'm the owner and a senior care advisor with Senior Care Authority of Southeast Texas. I've been right now looking after the interests and really being an advocate for seniors and their families for about 3 years now in the Southeast Texas area. I started in this business after retiring with a personal issue with my mom, who after her stroke, unfortunately couldn't go home and dad couldn't look after her. So it kind of fell on me to try and find the right place. And while I believe strongly that we always start looking at locations based on care and the level of care that they provide, but some of the other items that I maybe had overlooked were activities, certainly the location proximity to some of their family members, budget, which we'll talk about here today. And unfortunately, I ended up having to move her. And needless to say, it was bad enough having to move her to a community outside her own home at the first step. And then the second move was a little bit traumatic as well. So I felt there must be a better way. And that's what I try and do. And senior care advisors like myself who try and reduce family stress, really take in all of the aspects related to long-term living, care, location, activities, budget, meals, pets, languages, things of that nature as well, to ultimately find the right place. But in addition to my senior care placement services, I also work with families on veterans assistance to ensure that they understand the benefits that are available to them, make sure that they're getting everything that they're eligible for. Of course, any questions with regards to state long-term living solutions, specifically skilled nursing facilities or long-term acute care communities, Medicaid and what that covers or what it doesn't cover. So I actually help with families in the planning phases. And then, of course, I have a driving program for seniors, a self-assessment that is a nationally recognized program called Beyond Driving with Dignity. And my line is that no one wants to tell mom or dad they can't drive anymore, so they call me and I can help resolve that issue, because I'm a huge believer and proponent that giving up the keys should never mean a loss of independence. And certainly in this day and age, we've got just tremendous transportation options available to us. It's just being aware of what they are, planning for it to make sure that any senior who has made the decision to actually limit or give up the keys, give up their driving, that they have still that availability to get to Walmart, go see their doctor, get to church, go see their friends, all of those different pieces as well. And we're very fortunate in our area, the greater Houston area, that, we have some just great transportation options as well.
No, that's great, Jack. And senior care, it's a maze. It's extremely complex. Although we have a lot of benefits available to us, it's deciphering through those, and it's certainly a challenge. So, no, we definitely value what you do for the community.
Thank you.
Let's go into the understanding about the pay side for senior care. We'll start with Medicare, since Medicare is the biggest payer for a lot of these benefits. Does Medicare pay for long-term care facilities like assisted living, memory care, or nursing homes?
Sure. So the quick answer is no. And Medicare is in place as a federal health insurance program to really make sure that you've got hospital coverage, you've got doctors visits covered, for your general well-being and your health. And there are parts of the program that cover your prescriptions as well. You can get supplements to Medicare that help pay for things like dental and vision and enhanced prescription benefits and things of that nature. But the program is really in place for people 65 or older, or who may have a specific disability, to make sure that they have health insurance. And I think about more along the lines of medical insurance for, anything that you might need with regards to a hospital, or like what you may have had with your employer with your health insurance program. Now, the confusion, I think, really starts because there are certain benefits that come from the Medicare program that will cover a limited number of days in certainly a hospital stay, as we just mentioned, but also a skilled nursing facility. But they're very much in support of you getting better, and then ultimately that benefit ceasing, no longer needed, if you will. And in the Medicare program, at least as it exists today, and it changes every year, but it could be up to 100 days, but that would be inclusive of any days that you actually had in a hospital. Beyond that, you would actually be liable for any stays at the skilled nursing facility or within the hospital past those 100 days.
What services does Medicare pay for, and why
Sure.
do more people not utilize these services?
It's a great question, and I think it's to get to the second part of the question first. The idea is that it's awareness. It's really just being understanding and educated about what those services are. Fortunately, within the Medicare program, as we talked about, if it's anything specific to your well-being or getting better, so things like speech therapy, physical therapy, occupational therapy, any durable medical equipment. If you need a specialized hospital bed, or if you need a walker or a wheelchair that's under the doctor's orders, then that's really what Medicare will cover. They will pay for. In some cases, they'll actually assist with some benefits that could be realized within your home, but they are specific to your getting better. They're really revolve around your diagnosis and the expectation that you're on the road to recovery. And as long as that is in the let's say the diagnosis from the doctor or the hospital, then Medicare will be there to support it. It is a limited benefit, and it will be reviewed based on the number of days that you're actually receiving it. But if we think about durable medical equipment, your prescription drugs, hospital stays, doctor's visits, those are the pieces that are covered by let's say the foundation of Medicare. And now, of course, you may be aware that there are supplementals, and some people call them Medigap or Advantage plans, that can enhance the level of services that you can receive. Some of those would include, being able to see different types of doctors outside of a network, prescription programs that are not limited to generics, vision plans, dental plans, enhanced programs of that nature as well. But as we've talked about, in none of these do we see, anything specific to long-term care support.
Right. Yeah. What about our veterans? Does the VA pay for senior living? And what about
Yeah,
home care?
yeah, absolutely. No, so, and I'm sorry to interrupt you there. So I think within the veteran program, and it's just, I saw in 2018 that there was a real concerted effort by the government to step up the level of care for our veterans. Now, many of these programs have been in place for a long time, but I think it was an extension and expansion of what they already had. Everyone, at least in the military, is pretty much familiar with the pension program within the veterans benefits, but maybe some of these enhanced programs specific to long-term living and long-term care are not well understood. The best one that I've seen as of late is called Aid and Attendance, or ANA, under the Veteran Administration. It allows for any service member or their spouse, as long as they actually meet some relatively straightforward criteria to receive the benefit, and that is they will have had to have served in the military, not in a zone of conflict, but actually be in the military, in the service, one of the branches of the military, at specific times within times of conflict. So you think about the Vietnam War, the Korean War, World War II, Gulf War, all of those pieces as well. But there are specific dates outside of those as well. There is a financial criteria that must be met. It changes every year, but there's a limit on the number of assets that you would have to have. Your home is not included. Your cars are not included in that list of assets. So I would encourage anyone who may be not aware of aid and attendance, either to reach out to your representative at the VA or call someone like me. You know, consultations are always free, but the idea is that we want to try and create awareness. So if you're eligible for that benefit, you should be receiving it. The nice thing about the VA aid and attendance benefit is that it is retroactive to the date of application. So even though right now, I think the applications are running a little over 6 months for approval, you would actually get that benefit back to the date of application. So it's a wonderful benefit for individual veterans. That's this year is a little over $1,700 a month. For their surviving spouse, it's just a little under $1,300 a month. These change every year. And for a couple, it can be about $2,400 a month. And that's paid directly to the veteran or their spouse to be used as they either want to try and stay at home or look at assisted living or some sort of long-term care community. So it's a wonderful benefit that could really complement and supplement some of the resources and make some more things available. In addition, the VA does have 3 what I would call long-term care communities. Skilled nursing facility is really through the VA medical benefits. And in the Houston area, we really only have 1. There's probably maybe 2, another one up north. So it's very difficult to get into there. There's quite a long waiting list, if you will. In addition, there are some communities that would actually work directly with the VA to be able to provide a benefit. But again, very limited number of these communities out there. And you would have to have what we would consider to be a significant number of support for activities of daily living, washing, brushing your teeth, feeding, things of that nature, possibly some incontinence. And then there are some communities a little outside the Houston area, closer to some of the military bases that help support some of the VA long-term living as well.
No, wow, that's very, very interesting. I never knew that VA had so many options. That's actually very good.
Mm-hmm. It is, and I think to your point, Kash, that's exactly it. It's just it's unfortunate, but it does take a little bit of digging. There are great accredited VA claims representatives in the Houston area. Some charge a fee, many of them don't, and the reason it works is that in approval with the VA, they can actually charge a percentage. It's usually 15 to 18% of that period from when the time the claim is made until when it's paid, as a supplement for them for their services. So the veteran would not actually see anything out of pocket, but they're there to actually help them, and they are, as I've mentioned, accredited by the VA. Of course, the VA, the veterans, many of the veterans associations have representatives of Veterans of Foreign Wars, the VFW and some of the actual veteran groups around would actually have a representative be able to help as well.
Wow. Okay. So we covered a lot of the VA benefits, and we also established that Medicare does not pay for long-term care living facilities. Then what other ways are available for families to pay for senior care if Medicare is not covering the big chunk?
Absolutely. And I think now would be a good time to talk a little bit about Medicaid, because sometimes I get a lot of questions from families about Medicare, which is the federal health insurance program that we talked about earlier, and Medicaid, which is, there's some federal supplement, but Medicaid is being a state benefit that's run by the Health and Human Services. So Medicaid is really meant to support those individuals or families who are low or very low income. And, there's a table, as you can imagine, there's certainly some bureaucracy in filing for it. But in essence, you really need to have little to no assets. And there's a 5-year look back period against your assets to see if you would qualify. And then your income, again, this changes every year, but I think in 2022, for an individual, to be able to be eligible for Medicaid, you'd have to be looking at something just under $2,200 a month total, or your gross income before any expenses or taxes. And so, a couple of $1,000 a month of total income to be eligible for this benefit. And then the benefit itself would limit you to certain types of communities or facilities, and not all of them take the Medicaid benefit, unfortunately, and there's a lot of work going on to support it. So Medicaid does not pay for long-term living solutions for the bulk of the population, but it is really in place to be able to support those who are truly low or very low income. Does that make sense?
Yeah, it does.
So then when we look at the options for long-term living, we tend to evaluate that against what we think the type of living that we would like to have as our long-term scenario. Without a doubt, and I'm a huge proponent of it, if we can stay at home, stay at home. If the idea is of having a safe, caring environment whereby you can make some modifications for either ramps or grab rails and things of that nature, as long as it can be done safely, and the level of care, because it always starts with the level of care, regardless of all the other criteria, and we'll talk a little bit about them. But if we really make our planning around what our care levels are going to be, then everything else starts to fall in place. Home care companies that are out there right now provide assistance. Many of them are looking at a minimum of 4 hours per trip, but there's no minimum number of days. And they would really be there to help with some general housekeeping, custodial care, do the laundry, make a meal, possibly help with, a bath or a shower, things of that nature as well. And can really be, a tremendous resource to assist those who are really just needing maybe a little bit more help around the house to be able to stay at home. There's also home health care, and I know it sounds very similar to home care, but home health care is usually run by medical professionals, or have medical professionals who can actually do things like injections or do wound care or something else that might need maybe a little bit more of a medical professional to be able to support that activity at home. So if we're thinking about our home care activities right now, those are running, and we've seen, how difficult it's been for them to hold good caregivers. But those rates are running anywhere from $16 to $23 an hour. So at $4 hours minimum, if you go beyond that, or certainly a multiple number of days, that could add up very quickly. For home health care with the medical professionals, those are usually ranging somewhere from $26 to $33 or $35 an hour. Because of the standards of the professionals that are given the care. Again, similar to that could start to add up very quickly. So while home care and staying at home is certainly, being able to plan for that for as long as you can, good. But then if you need some additional care, better supervision, more support with medication management or incontinence issues and things of that nature, or you're looking, or the senior or the family's looking for their loved ones to be in more of a social environment, then we can actually start looking at the next level of care. And that's either in the form of assisted living, which many of us are familiar with, or residential home cares. We're fortunate here in Texas that we have these smaller homes that if you were in a residential community, you wouldn't even know that they were care homes. They're for residents or more. They have to be licensed by the state. And I really encourage that, because it does give us access to inspection reports, formal complaints, things of that nature, where we can really check and make sure they're doing everything they should be doing. These communities are in place really, as I mentioned, provide social activities and assisted living with activities of daily living. In many cases, you can go from the smaller homes to almost apartment style living as an option. And I jumped to assisted living, but actually there's an independent living solution, which is more like a senior apartment style of living, or a community that you might see out there that has a rec center or social center or pavilion or things of that nature, and is really geared around the seniors. As we start looking at independent living here in Texas, these are starting, you're looking maybe $2,200 a month, all the way up to cruise ship living. And here in Texas, certainly in the Houston area, and when I say cruise ship living, you could be spending $10,000 a month if you're down in the River Oaks area. But there's no need for that, unless that's the type of resources that you have, and that's the type of living that you're prepared to invest in, then that's fine. But for the majority of the public, we're looking at these independent living communities starting at around that $2,200, $2,500 a month. Beyond that, into assisted living that we were talking about, now we're getting closer to $3,000, $3,500 a month. And I'll just stop here and preface it with, whenever we're looking at these long-term living agreements, many of them are month to month. There's not anything that you would actually see really long-term in terms of, locked into anything like you would see with an apartment. But we have to be at least aware of any inflationary adjustments that the owners of the home would be may have written into the contract. Historically, we've been looking at somewhere from 2 to 5% annual increases on the numbers that I've just been providing you. Not every place does that. In many cases, they'll actually lock you into the rate for the life of the resident, for the stay of the resident, excuse me. Not everyone passes. Some people decide to move to a different community. But it is something to be aware of whenever you're talking about the finances for these locations. At least look into a little bit more about what are their annual increases, what have they been for the last 3 or 4 years, because it really makes a difference when you're trying to do your budget. It never hurts to ask to lock in that rate for the duration of the stay. They can only say no, but many times that is an area of negotiation that people can actually use for it as well. So beyond assisted living, now we're looking at something of maybe some higher acuity needs, higher care needs. And now we're looking at more of the memory care type of environment. Many cases, you need a diagnosis of some form of dementia or some sort of memory issues or behavioral issues to be able to be in those communities, because they are secure. And by that, they are access controlled. Entry and exit points there for the benefit of the residents, so nobody just kind of wanders off. So you need to have that diagnosis dementia. These diagnosis of dementia or some sort of behavioral issue. So many of these will start closer to the $4,300, $4,500, $5,000 a month range and go up there. Here in Texas, we're actually averaging closer to about $6,000 a month. Now, when I say $6,000 a month, and these prices that we're quoting, these should be all inclusive. They should be all inclusive of everything. And by that, I mean laundry, housekeeping, all meals, hydration, snacks, utilities, Wi-Fi, all those different pieces should be inclusive. Where you're going to see some specific changes are going to be whether or not they provide furniture. Incontinence supplies, because they can vary by individual, they usually leave that up to the family or the senior. And of course, any personal toiletries, if they have a preference for a toothpaste or a shampoo or something like that, then that would be on the responsibility of the family or the senior. But for the most part, everything else should be all inclusive. They sometimes do have levels of care, and that is maybe 2 or 3 levels of care where it is a nominal increase. And these are meant to cover things like a 2-person transfer where you need 2 caregivers to move someone around, or someone's actually being tube fed or is bed bound and needs that extra level of care, and it takes more time. So you can see some nominal increases, another $300 or $500 a month specific to that level of care. From memory care, now we're into more of acute care type of situations, and those are really things like skilled nursing facilities. where you actually are looking at, here in Texas, we average a little over $9,000 a month for those types of communities. It's gotten so much better from the 1980s when we used to think of skilled nursing facilities as being kind of a ward type of environment. They are no longer that's the case. They're just some wonderful skilled nursing communities out there. But these are very much built around a medical need, some sort of diagnosis for the individual that's going to be able to provide them that hospital or type of level of care. Skilled nurses, registered nurses, CNAs, things of that nature to be able to support it. All of the communities that we talked about would support companies like Varco to be able to provide home health and specifically hospice. And hospice is not always, you know this way better than me, Kash, and you can certainly interject, but to be able to provide that level of care for that individual based on that medical need or some sort of diagnosis. And maybe you could talk a little bit about hospice for me.
Yeah, no. So I think we covered a lot of the payment options, and hospice is one of those which is completely covered by Medicare.
Right.
So that's, and I usually tell families that when you're in an assisted living or a personal care home, like what you mentioned, if the patient qualifies for hospice, and that's a key thing here, you have to qualify to go on
Correct.
hospice.
Yeah.
Then some of those costs that you may be incurring will get covered by hospice. So it's a reduction in the total fees that you may be paying, and overall it starts to give an elevated level of care to the resident as well, because now we're bringing in medically certified staff, and they all have to be hospice specialists, obviously, and so on and so forth. So
Yeah. Absolutely. Thank you for that. So we've talked about the different levels of care, and I don't want your viewers to get a little lost because it can be a little, overwhelming on all these different options and all these different levels. And that's where I think you reach out, to senior care advisors like, you or I, where we can at least provide some guidance and comfort in the fact that, look, this is there's some planning involved here, but you don't have to do this on your own. There's processes and procedures and, good techniques to put a plan in place for this. And that, I think, to your point then, Kasha, of how do we pay for it? So private pay, is what everyone immediately defaults to. Okay, well, how much do I have in my savings account, and how am I going to pay for this? And we all think that's going to run out very quickly. Of course, the question I always get is, well, how long is that going to last, and how long am I going to live? And if I knew that, I'd probably be doing something else. But I think planning and really putting a good care plan in place, starting with the care, and then from that, allowing for some adjustments down the road. One community we didn't talk about that's just really opening up, I think we have 7 in the Houston area now, and it keeps growing, are these continuing care retirement communities, CCRC. And there's a number around town right now where basically you buy into it, just like buying a condo, and then you're guaranteed your level of care at specific rates if your care level should need. So you kind of come in and independent living, you can come in at any level, but from there, if you need assisted living, if you need memory care, if you need skilled nursing, it's all contained within that one community or that one kind of campus, if you will. So that's kind of another way that people have been doing it. We hear things like reverse mortgages and those being able to support it, sell your home. Certainly, without a doubt, that's part of it as well. Long-term care insurance policies have gotten so much better from the early 1990s when they were out there. There's some really wonderful programs out there and great insurance providers to be able to provide it. If you have one and are not really sure what you have, I would encourage you to get a review on that in layman's terms so you can actually understand, is there a waiting period? What does it actually cover? Some of these are prorated against the number of assistance, the amount of assistance that you need. If you just need help with dressing and making a meal, that pays a certain amount. If you need with dressing, making a meal, and getting a shower, that pays a different amount. So those policies are still out there, but the ones that have been written late 1990s forward, most of them are very good and provide enough to be able to cover those costs that we just talked about. If we're a little later in life when we haven't really thought about that, and we don't have a long-term care insurance program, and we're looking at, well, how else do we do this beyond, asking the kids for support, selling our home or getting a reverse mortgage. One thing I would really encourage your viewers to think about is that if you have a life insurance policy, please do not stop paying your premiums. Even if you feel that you've got enough life insurance coverage, if you have a policy that's in place, regardless of what is on the cash value of that life insurance policy, please reach out to a life insurance specialist. Right now, with the number of people that we have and the number of seniors that we're getting every day, we talk about 10,000 in the country turning 65 every day, there are new programs for life insurance buybacks. And these are companies that will actually buy your life insurance from you, pay you cash. As a tax-free benefit, if you will. It's an asset that you're selling. And provide you with cash to be able to support whatever you feel you need some help with. So if you have a life insurance policy and you think, well, the premiums get too much, or I don't really want to do this, please do not let it lapse. Reach out to a life insurance specialist, and we can look at getting some real value out of this. These organizations paying for that policy. In addition to that, I had some other pieces in here as well. We've got hybrid insurance, which is long-term care and life insurance. As mentioned, as the need continues to grow for these types of products, then we're going to see our insurance companies being able to step up and provide a lot more options to be able to do that. We've got, of course, social insurance, home care. But one thing I would also say is that I'm starting to see a number of religious affiliations be stepping out from just the church themselves and starting to have their own, for their congregation, for their members, assisted living communities or long-term care communities. They limit it to the members of their church. But many of those are being done at a reduced fee as well, in proximity to where the church is. So we're starting to see a lot more options, if you will, on long-term paying for the long-term care, depending upon the level that we're in need of.
Well, Jack, it is crystal clear to me that this is a maze. It's extremely complex.
Yeah.
And although the trigger is rather emotional, the decision-making process needs to be very, very practical. And I think this is where experts like you, need to be engaged with, so that you can look at the whole picture and figure out what multiple options can be used to do this right. So with that, Jack, how do the viewers get in touch with you?
Well, thank you very much, Kash. They can always reach out to me at Senior Care Authority. The website that's up there right now, www.seniorcare-southeasttexas.com. I'm on Facebook and LinkedIn and Twitter as well. My telephone number is area code 936-225-4373. That's 936-225-4373. Or you can just Google Senior Care Authority and search for it that way. There's as with those of us who'd like to provide these services, there should never be any fee for consultation. We're independent. We don't work for any of these communities. We visit these places on our own to see what they smell like, or their caregivers are on their phone, and we really are, I think, an advocate on behalf of the senior and the family to try and make sure that they are aware of their best options based on care, activities, location, budget, all those pieces that we talked about earlier.
Well, Jack, every time you come on the show, I learn a lot. I love having you on the show. Thank you for being a great guest, and thank you for sharing all this information with our viewers.
Thank you, Kash. Thank you for all you do as well. I appreciate it.